There are two major types of connective tissue proper. They are loose connective tissue and dense connective tissue. Loose connective tissue has a loose, open framework. Cells and fibers are loosely packed in the ground substance. Dense connective tissue has a dense structure. Cells and fibers are densely packed in the ground substance. Loose connective tissue is the packing material of the body. It cushions, supports, and fills the spaces between tissues and organs. Loose connective tissue is found all over the body. Dense connective tissue is mostly composed of collagen fibers. It's found in tissues where strength is needed, and therefore it is found in tendons, ligaments, the skin, and also enclosing many organs as a sheath or a bag around the organs. So now we're going to talk about loose connective tissue in more depth. There are three types of loose connective tissue: areolar connective tissue, reticular connective tissue, and adipose connective tissue. All of these will show up in your future anatomical studies. So areolar connective tissue, which so far has been used as the example of connective tissue proper, has an open framework. It contains all of the connective tissue proper cells and fibers, and there is a large amount of ground substance. Overall, areolar connective tissue is somewhat gelatinous and a bit stretchy. It does have some elastic fibers in it. It supports, cushions, and protects organs. It's found all over the body, including in the skin, the respiratory, digestive, and urinary tracts, around blood vessels and nerves, around joints, and between muscles. So, it will come up again and again. Reticular connective tissue consists of reticular fibers that form a web around the functional or working cells in an organ. It contains fibroblasts, fibrocytes, and macrophages. It supports the functional cells of an organ and gives structure to the organs. And it's found in the liver, the spleen, the kidney, the lymph nodes, and the bone marrow. And I know this sounds a little bit redundant because the explanation of reticular fibers went over some of this ground, but now we're talking not just about the fibers, but about the connective tissue that they form. All right, adipose connective tissue is areolar connective tissue that contains mostly adipocytes or fat cells. Note, almost all areolar connective tissue contains some adipocytes, as we saw in our picture of areolar connective tissue, where we pointed out adipocytes when we were talking about the different kinds of cells. But in adipose connective tissue, almost all of the cells are fat cells. Okay, and of course, adipocytes store lipids that can be used for energy. So adipocytes, in addition to storing energy, cushion and protect the body and reduce heat loss. When more energy is consumed than is used, adipocytes, and therefore adipose connective tissue, increase in size. We would call it gaining weight. Adipose connective tissue is found under the skin throughout the body, in the buttocks, the thighs, and the breasts, particularly, and around the heart, the digestive organs, the kidneys, and the eyeballs to cushion them. For your information, just FYI, there is a kind of adipose tissue called brown fat. The reason it's brown is because the adipocytes have many mitochondria, and there are many blood vessels between the cells, and these features make the fat look brown. Brown fat can be broken down quickly to release heat, and it's usually found in infants and young children more than adults. It helps keep infants and young children warm. They have a less mature thermal regulation system, so this brown fat helps keep them warm. And interestingly, adults can increase brown fat through cold exposure, like cold plunges, surfing without a wetsuit, that kind of thing. All right, now connective tissue proper, types of dense connective tissue. So there's two types of dense connective tissue: dense regular connective tissue and dense irregular connective tissue. And there's also an important subtype of dense regular connective tissue called elastic connective tissue. Now, in Martini's, they have them listed, 1, 2, 3 here. So it looks like there's 3 types of dense connective tissue, but elastic tissue is actually a subtype of dense regular connective tissue. Dense regular connective tissue contains collagen fibers packed together tightly in parallel bundles. Fiber sites are found between the collagen fibers. This is the strongest connective tissue proper. And here we have a picture and a slide showing us just, many, many collagen fiber bundles, and then squeezed between them are the fiber sites. Dense, regular connective tissue is found in tendons that connect muscles to bones and ligaments that connect bones to bones. Tendons contain fewer elastic fibers than ligaments, and they don't stretch as much as ligaments. Dense, regular connective tissue is also found in aponeuroses, or sheets of connective tissue that often surround and support muscles. When we learn about the abdominal muscles, we'll learn that there's an abdominal aponeurosis, like a big old sheet of connective tissue surrounding the different abdominal muscles. Okay, elastic connective tissue is a type of dense, regular connective tissue. It contains many elastic fibers, and it can stretch and recoil. It is very strong and very flexible. Elastic connective tissue is found in the walls of blood vessels, the walls of airways, and the ligaments of the vertebral column. Dense, irregular connective tissue contains collagen fibers in bundles oriented in different directions, not in neat parallel bundles. The bundles form a strong mesh that resists stress from many directions. Dense, irregular connective tissue is found in a layer below the surface of the skin. It also forms capsules around organs like the liver, the kidney, and the spleen, and it forms sheaths around nerves, cartilage, bones, and muscles. I always think of dense, irregular connective tissue as sort of like a tarp that you use like over outdoor, like piles of stuff you don't want to get wet. That is just very strong from many different directions because it's like a woven mesh. All right, just a word on connective tissue fibers and connective tissue types. They are named in a repetitive way that can cause confusion. So fibers are protein molecules, and tissues are groups of cells that work together to perform a specific function. So they're different. And it is true that many reticular fibers are found in reticular connective tissue, and many elastic fibers are found in elastic connective tissue, but you can think of them, distinctly, right? And over here on the side, I have a list of the connective tissue fibers, and in red, I have the fibers that are going to show up as names also of tissues. So we have reticular fibers and elastic fibers that are going to show up as reticular connective tissue and as dense, regular, elastic connective tissue. And you'll see if we look here, here's a picture showing you close-up of the black reticular fibers in the liver and the black stained elastic fibers in an artery. But we can also look at organs as a whole. Here we have a liver, and it is full of reticular connective tissue, which is, of course, full of reticular fibers, right? And over here, we have a picture of the vertebral column, in particular, showing you a ligament inside the vertebral canal. And this tissue has a lot of elastic fibers in it, but it's called an elastic connective tissue when it's found in the ligament of the vertebral column. So they're definitely very related, the concept of the fibers and then the concept of the tissues. I'll say no more.